I have a patient that's about to enter my office today who's going to get treated for weight loss syndrome. So I'm going to kind of help her lose a little bit of weight. Part of the plan is we're going to use 3 different auricular points in the ear. I'm going to show you where those are. There's a little curved area right here in the ear. Almost everybody has different shaped ears somewhat, but basically the landmarks are generally the same. This area right here is called the triangular fascia, I guess because it's shaped like a little triangle. And in the upper corner right here is a point that's called shenmen. Shenmen basically means to calm the spirits, and a lot of times when we're dealing with addictions, people have lots of cravings for food and what have you, and this is going to help calm that down. This works with the vagal nerve, again, which goes directly to the hypothalamus of the brain, and it releases endorphins to help the body to calm down. There's several different ways you can treat these points. That's one of them. The other that I'm going to be using is called point 0. It's geographically the center of the ear. If you measure from top to bottom and side to side and went right in the very center, right at the end of that little ridge there, is called point 0. That's like a reset button. That's basically telling the brain that we want to have new types of ways of dealing with stress as opposed to eating or smoking or drinking or whatever that substance was. And then right here on the right on the edge of the little lip that sticks over there is a point that is used as a mouth point. It helps control food cravings. So I'm going to show you 3 different applications. You could just basically do acupressure. This is just a simple cotton swab, or you can use a toothpick or the back of a pen or something like that, and just do a little pressure on that point. You'll be able to locate it pretty easily because your patient will usually tell you, ouch, that's a little bit more tender. So you kind of palpate around just a little bit. The points in the ear move slightly, but that right there, the Shenmen point, is very, very effective. So that's acupressure. Now the second choice we have, and we're going to be doing this today, is going to be acupuncture. Now here we have a needle that's in the little guide tube, little plastic tube, because the needles are so thin that if you tried to put them in without the guide tube, they probably wouldn't stick. And we're going to do the point 0 point with this one. We're going to put it right on the spot, tap the tip of the needle, and that's basically all there is to it. It doesn't stick in a whole lot. Works like an antenna, basically. It doesn't cause the patient any pain, but again, leave it in for about 10 or 15 minutes, and then remove the needles. Very, very effective. And then another way you can treat is we use acupressure pellets. In this case, these are magnets, little tiny magnets that are on a little strip of paper here with a little bit of tape on them. And you simply take your tweezers, locate the point that you want, apply it, give it a little pressure so it'll stay. And that's actually a little tiny magnet. Looks like a little BB, and they have different strengths of magnetism there. And basically what that'll do is that'll work around the clock 24/7. You can usually leave that point in, or several selections of points, as long as maybe 2 or 3 days. And then when you're ready to take the point out, just simply reach up there with your finger, scratch it, and remove it. So one of the really, really effective ways to treat addictions is auricular therapy.